This patient came to see me almost 2 years ago regarding tooth number 4. According to the patient, the root canal was done a few years prior to her seeing me. And you can see a crown on the tooth, previous root canal. And you can see a large periapical lucency. Look at that. That's a large periapical lucency right there. And patient had symptoms. Also, she said that she had a swelling above the tooth and saw her dentist. Her dentist put her on antibiotics and referred her to us. By the time I saw her, there was no swelling, soft tissue swelling superior to the tooth, but the tooth was very tender to percussion and palpation. Probings were all 2 or 3 millimeters. Again, you can see based on the radiograph here, previous root canal and a large periapical lucency. So we talked about options with the patient, about redoing the root canal, having to go through the crown, so she might need a new crown. We don't do crowns, that's her dentist. Go through the crown, redo the root canal. No promise or guarantees. We'll do our best. The success rate for a redoing of a root canal with an abscess infection is about 70 to 80%. So that means that out of 100 of these that we do, about 20 to 30%, there's potential for failure. So that either we could do that, or the other option, alternative, would be to extract the tooth. Patient said she wanted to try to see if tooth could be saved. So that's what we did. We went through the crown, removed the gutta percha, redid the root canal in 1 appointment. Here's the date when I first saw her for the consultation. As you can see, almost 2 years ago. Okay. This was immediately after we did the root canal. You can see the dentist had missed the canal. So we were able to locate that missed canal. They joined, but anyways, if you leave necrotic tissue and bacteria behind, it doesn't matter if they join, canals join or not. Over time, there's potential for endodontic failure and an abscess. You can see that huge periapical lucency there. Again, with this, we redid the root canal in 1 appointment. This is immediately after we redid the root canal in 1 appointment. And there is sealer extrusion also. So let's see, will this root canal fail because we redid it in 1 appointment and there's sealer extrusion? And here's the date, as you can see, 1/8/2022. So about 2 years ago, when we redid the root canal in 1 appointment and sealer extrusion a little bit right there. This was just now, today. 2 years post-op of tooth number 4. As you can see, that large periapical lucency healed completely. Patient has no symptoms, no swelling whatsoever. Tooth percussed and palpated within normal limits. Probings were 2 to 3 millimeters. Again, you can see that large periapical lucency healed completely. We redid the root canal in 1 appointment. So again, another example. I've posted hundreds of them. Redoing a root canal. You can redo it in 1 appointment as long as you can get the canal dry. Sealer extrusion doesn't cause endodontic failure. And here it is. Redoing the root canal in one appointment doesn't cause endodontic failure. Sealer extrusion doesn't cause endodontic failure. And here another example. Again, I've posted hundreds of them. You can just scroll through my videos and you'll find them. Here they are, side by side. 2 years ago, pre-op, before we redid the root canal, you can see that large periapical lucency right there. And that was today, 2 years post-op. We did the root canal in 1 appointment. That's the outcome. Sealer extrusion doesn't cause endodontic failure. Redoing the root canal in 1 appointment doesn't cause endodontic failure. And this is another example. Again, I've posted hundreds of them. Hundreds of these examples. Pre-op, you can see almost 2 years ago. And this was today, 2 years post-op. And as you can see, here's the date. So 2 years post-op of tooth number 4. 1 appointment. Endodontic retreatment doesn't cause endodontic failure. Sealer extrusion doesn't cause endodontic failure. Going through a crown to redo the root canal doesn't cause endodontic failure.